Hi, I'm Dr. Weiner from Tucson, Arizona. I'm a bariatric surgeon. And through my website, I have people sometimes send me questions, and then I make a video and answer them. So today's question comes to us regarding postoperative nutrition and whether you should be focusing on protein or produce. This is a very common question and a very common cause of misunderstanding about what you should be eating after surgery. So let's hear the question.
Hi, Dr. Weiner. I had a Roux-en-Y gastric bypass September 29th, 2021. My starting weight was 257 pounds. I am now 218 pounds, and that's my
Good weight
current
loss.
and lowest weight. My question is on the pound of cure plan. I know how much vegetables we're supposed to eat, but you have us at 6 months after surgery, you say to go switch your focus from protein to produce. And I'm wondering how much protein we're supposed to have at that 6 months mark.
Okay, so how much protein should you be eating after bariatric surgery at 6 months if you're also supposed to be switching over to focusing on produce? So, the reason that there's so much confusion about this protein or produce after bariatric surgery is because the answer is different at different points in your progression from surgery. So, if we look at the lifeline of a bariatric patient, and we kind of look at their weight on this axis and time on this axis, you have the surgery initially and you lose a lot of weight pretty rapidly. And then as time passes, it slows down, and then ideally you kind of settle out at a stable weight. So most people will stop losing weight or come very close to their final weight around 12 months, 1 year after surgery. Now, men oftentimes will stop a little bit earlier, maybe around 6 months. And if you start out with a lot of weight to lose, it can take up to 18 months, or I've even seen 2 years for people to kind of reach their steady state weight. But in general, 1 year is a pretty good guideline. Now, they asked a question, they said at 6 months we switch. It's not quite that simple. It's If we look at what's happening after surgery, if we look at those first few months, 1 month, say 1, 2, maybe even month 3, I refer to this as the recovery phase. And during this phase, you are recovering from surgery. Eating is difficult. Getting enough nutrition is difficult. Getting enough fluid is difficult. Making sure you take your vitamins is difficult. It is a struggle to meet your nutritional goals. During that phase, it's critically important that you focus on protein and getting as much protein in as you possibly can. In my practice, we say minimum of 60 grams, ideally 80 grams. I hear some practices are saying up to 100 grams. I don't really think it matters what the actual number is. The point is, you should get as much protein in as you can. But then as you get to the end of month 2 or 3, you start to be able to meet these requirements fairly easily. And at that point, we start to add in some produce. So you've got a little extra room, say month 3 or 4, you can meet your protein, meet your fluid requirements, you're taking your vitamins without a problem. Add in a little produce at that point. Add some beans in, some nuts, some seeds, some lean animal protein. Start migrating slowly toward that pound of cure diet. Now, what happens is at some point, the weight loss really starts to slow. And I will use many factors when I talk to patients about this in the office. I'll look at their weight loss. Is their weight loss starting to slow? I'll look at their protein levels on their blood work. Is their protein level adequate? I'll look at how comfortable they're eating. Are they having any difficulty with eating, or is eating comfortable? But somewhere maybe at the earliest month 6 after surgery, but probably more like month 9, 10, 11, toward the end of the first year, we really switch from a protein focus. And this is where our focus becomes produce, where we should try to eat as much produce with every meal. And eating a lot of fruit and vegetables and nuts and seeds and beans should now take priority over getting protein. So this person asks the question, how much protein should they get once they've switched over to a produce focus? And the answer is however much they eat. We're no longer tracking that. eating enough protein is critical for your survival. It's critical so you don't lose muscle mass and hair, and you feel healthy, and you don't develop signs of malnutrition. That's really only a concern in the very early recovery phase. But as you get further out, it's no longer a concern. If you have ready access to protein, are able to eat comfortably, you will meet your protein needs. Your body will figure this out for you. Our body has an amazing ability to sense what nutrients we need, and it changes our food cravings. This is why some days we feel like eating some types of foods, and other days we like a different type of food. And that's because our body is constantly sensing our nutritional state and and driving us to seek out foods that will fill our unmet nutritional needs. So you don't have to count protein. You don't have to worry about protein as long as you're eating comfortably, as long as you're meeting your needs. Once the weight loss slows and you enter this kind of more honeymoon phase where you're able to maintain your weight, you have good satiety or feelings of fullness with eating, you can just focus on produce, because that is going to set you up for long-term success, for long-term weight loss and weight maintenance. A high protein diet doesn't help with weight loss. If you use a keto diet, you can make some arguments that that's helpful, but it's really more about not eating the carbs instead of eating the protein. Eating protein doesn't cause weight loss. Eating produce causes weight loss. It helps you stabilize your weight. So if you want to find out more about our nutritional program, you can check out our website. I have 10 online courses, many of which are free that you can take. We also have our own nutrition program guided by my practice's dietitian, and you can log in via Zoom, and she has about 20 to 25 group coaching sessions that you can join from anywhere you want. That's free to the public. There's just a relatively low monthly fee that we charge. So I hope that answers this question. And for those of you who have kind of gotten past the recovery phase and are now focusing more on weight maintenance, it's time to switch over to eating produce.